Hi guys, you're welcome to Dssg Nation. So if this is your first time watching a video from Dssg Nation, do make sure you subscribe and you hit the bell button so we can notify you whenever we create a video. So today we are going to be talking about diabetes insipidus. So pick your paper and your pen and let's get started. Hi guys. Yeah, welcome back. So we said we are going to be talking about diabetes insipidus. So what is diabetes insipidus? Diabetes insipidus. Now, the word diabetes. So diabetes, it means to pass out. To pass out. And most especially through urine, or to pass through. To pass through. Or you can also call it to urinate. So, to urinate. So the word in means no. It's a Latin word. Or you say not. And the word sipidus is from sapidus. Sapidus. And sapidus means tasty. Tasty. So when you say diabetes insipidus, it literally means to urinate a tasteless urine. So because it is not tasty, still the same thing as tasteless. So in diabetes insipidus, those patients, they used to urinate a tasteless urine. And when urine is tasteless, rather, sorry about that. So when urine is tasteless, it means it is diluted. So it is a diluted urine. So let's go deep into diabetes insipidus. What is the cause of diabetes insipidus? So stay tuned. Yeah, welcome back. So we're talking about the DI, diabetes insipidus. So what is the cause? Before we talk about the cause, let's talk about the mode of action of an hormone called the ADH. Now, in the brain, we have the hypothalamus. So the hypothalamus. So we said the hypothalamus has a kind of connection with the pituitary gland. So the posterior part is connected with the posterior part of the pituitary with nerves. So through nerves rather. And this is the nucleus. So now there's a kind of hormone produced by the hypothalamus, the posterior hypothalamus. So that hormone is called ABDH, and that is antidiuretic hormone. So what is the meaning of antidiuretic hormone? The word anti means against, and this D is from the word diuresis, which means loss of water. And the word hormone, we know, like a chemical messenger. So our hormone is a messenger. So now, can you guess the function of antidiuretic hormone now? It is a messenger that prevents or against loss of water. So the mode through which you can get rid of water from our body, the mode of losing water, ways of getting water out of our body, one of those modes is urination. So through urination, you are going to lose water. But this hormone called antidiuretic hormone, it prevents excessive urination. So how? That is what we are going to talk about in the next thing. So let me just explain this and then we move to the effect of antidiuretic hormone. Stay tuned. Yeah, welcome. So we said antidiuretic hormone is produced by the hypothalamus, and then the hypothalamus is going to direct it to the posterior pituitary. So, and all these structures are in the brain. So the brain is going to release ADH, antidiuretic hormone. So, and the function of this antidiuretic hormone is to do what? Against diuresis, the loss of water. Is to against the loss of water. Now, where it is going to act? So it is secreted into the blood, So it is secreted into the blood. It is secreted into the bloodstream. So the ADH is now in the blood. And now it is going to be directed. The ADH is going to be directed into a unit of the body. That is the unit of the kidney, which is called the nephron. So your nephron looks like this. It looks like this. Now, this is what a nephron looks like. And now within the nephron, we have a lot of water there. So, and that nephron is the one responsible for producing urine. So the water is going to move through the nephron, and then it is going to be excreted out as urine. That is just the normal formation of urine. So the filtrate, the water is going to pass through the what? Through the nephron, and then it's going to be passed out through urine. Now, what is now the function of this ADH on this nephron? So I'm going to come in with a bigger diagram that will give us a better understanding of this ADH and nephron. So stay tuned. Yeah, welcome back. Now, we said this is nephron, the nephron. So we said this is the nephron. Now, when ADH is released by the brain into the blood, so it is going to circulate. It is going to circulate to this, to the kidney. And then what is the function of this ADH on the nephron? Now, the nephron, it has some kind of receptors on it. Receptors. So some kind of receptors on it. And the function of these receptors is to allow for the binding of ADH. So the ADH is going to bind on this receptor. It's going to bind on these receptors. And when this ADH binds with these receptors, it is going to tell the nephron to reabsorb the water that is inside it. So the function of this ADH is to against water loss. So nearly all the water inside this place, nearly all the water inside the nephron is going to be reabsorbed back into the blood. And that is the function of ADH. So the ADH, it acts on the nephron to reabsorb water back into the blood. And that is the function of the ADH. Now, in diabetes insipidus, this ADH is no more, it is not produced, or these receptors are not sensitive to this ADH. And that is going to take us to the type of diabetes insipidus. But now I think we all understand the mode of action of ADH. So the ADH is secreted into the blood, and then it binds with the receptors of the nephron, and after then, that will lead to what? The absorption of water from the nephron. Then the amount of water loss is going to be what? Is going to be reduced. So the amount of water loss is going to be reduced. So if there is no production of ADH, the amount of water loss is going to increase. So now, let's talk about the types of diabetes insipidus. Stay tuned. Yeah, well done. So now we are going to talk about the types of diabetes insipidus. So majorly we have two types. So the first one is called the nephrogenic diabetes insipidus, and the second one is called the neurogenic diabetes insipidus. Now, what is the meaning of nephrogenic? What is the meaning of neurogenic? Now, let's start with the neurogenic. The word neuro is denoting the neuron. And now, don't forget, we said a neuron is connecting the posterior hypothalamus with the posterior pituitary. Like a neuron is connecting the hypothalamus, so the hypothalamus ahead with the what? With the pituitary below. So we said this neuron is going to receive ADH produced by this posterior hypothalamus, and it's going to transfer the ADH and store it inside the what? Inside the posterior pituitary. Pituitary. Now imagine that this neuron becomes damaged. If it becomes damaged, that will lead to what? Lead to or no production of antidiuretic hormone. So there will be no antidiuretic hormone again. So any disorder that affects the brain is called the neurogenic diabetes insipidus. I mean any disorder that affects the brain that prevents it from producing ADH, antidiuretic hormone. That is what we call the neurogenic insipidus. So tumor can cause it. Tumor, a stroke can cause it. Stroke, and some other things that can affect the brain. So anything affecting the brain that leads to the reduction in the production of ADH, that is what we call the neurogenic diabetes insipidus. Now, to the nephrogenic, this word nephro is denoting the nephron. Now, remember that we said the nephron, the cells, this nephron, it has some kind of receptors. It has receptors on it. So we said it has what? It has receptors on it. So receptors that allow for the binding of ADH. So ADH is going to bind with these receptors. Now imagine that these receptors are no more working. So if they are no more working, it means ADH will not be able to act on this nephron. So therefore, there will be no reabsorption of water, and there will be excessive loss of water in the brain. So the nephrogenic diabetes mellitus, so the causes, the diabetes mellitus are caused due to the defect in the receptors of the nephron. So example of those things that can lead to nephrogenic diabetes insipidus is renal failure. Renal failure. So when there is renal failure, the receptors of the nephron can be damaged, including the nephron themselves. So the ADH will not be able to act on the nephron, and when this is happening, it means the antidiuretic hormone will not be able to reabsorb water from the nephron. So these are the two types, and that is the meaning of the nephrogenic and the neurogenic diabetes insipidus. Now let's talk about the pathophysiology of diabetes insipidus. Stay tuned. You're welcome. So let's talk about the pathophysiology of DI. Pathophysiology of DI. Pathophysiology of diabetes insipidus. Now we said in diabetes insipidus, the ADH is going to act on the nephron. So it's going to act on the receptors of the nephron. So we said it's going to act on the receptors of the nephron. Receptors of the nephron, and it's going to bring about the reabsorption of water into the blood. Now, in diabetes insipidus, it's either that there is no production of ADH, or the receptors right here are not functioning. So now, either of the two, same thing is going to happen. And what is that? The water within the nephron, they won't be able to be reabsorbed back into the bloodstream, and there will be a lot of water. So the water is going to be doing what? The water is going to be passing out through the collecting duct. It is going to be passing out as urine. And according to osmosis.org, this proximal convoluted tubule is reabsorbing about 90% of water, and the collecting duct is reabsorbing the remaining 10%. So all this water, they are going to go out with urine, and that is going to lead to the dilute urine. Now, because there is huge loads of water bursting out through the urine, this will lead to a term that we call the polyuria. Polyuria, and that is the sign. So poly means increased, or large amount of something. When you say urea, it's denoting the urine. So the person will be urinating excessively. And now what is going to happen? Since the person is urinating excessively, water is coming out of the person's body. All this water is supposed to go into the what? Into the blood. Now, when this water are not going back into the blood, what is going to happen is there will be reduction in what? In the blood volume. Because water is one of those things that make up the blood volume. Now, this water is no more in the blood. So there will be reduction in blood volume. And now what is going to happen next? So far there is reduction in blood volume. That is going to trigger a mechanism that we've done. That is the renin, angiotensin, aldosterone system. So due to the reduction in the blood volume, this will trigger a mechanism called the renin, angiotensin, aldosterone system. If you have not watched it, I'm going to drop a link ahead. Just make sure you go there and you will understand what the RAS is all about. Now, the reduction in the blood volume will lead to the production of renin. And when renin is produced, renin is going to it is going to stimulate the thirst center of the brain. The thirst center. And that thirst center of the brain is going to tell the person to drink more water. That, hey guy, you are very thirsty, you have to drink water. And the person will be taking excessive amount of water. And this excessive thirst is called polydipsia. Polydipsia. So polydipsia means excessive thirst. So, and that will make the person to be drinking more water excessively. Now, after that, what is going to happen next? Let me just explain the word and we'll talk about that. But a quick recap. We said, due to the fact that the ADH is not able to act on the receptor due to reduced production or insensitivity of the receptor to antidiuretic hormone, what will happen is that there will be a lot of water in the nephron, and a lot of water in the nephron is going to lead to excretion of a lot of urine, and that urine is going to be diluted. That's a sign, and then this is also manifested as polyuria, like there will be excess amount of urine. So, and now with the fact that the water that is supposed to be going back into the blood is coming out as urine, the person is going to have a reduced blood volume, and this reduced blood volume is going to trigger the production of renin in a mechanism called RAS. So renin is going to trigger the thirst center. It is going to stimulate the thirst center of the brain that the person has to drink water, and this will lead to polydipsia, which is excessive thirst. Stay tuned. Yeah, welcome back. Now, we were discussing the pathophysiology of diabetes insipidus. So we said in diabetes insipidus, the production of ADH is impaired. So either we have reduction of production of antidiuretic hormone, or the receptors of the nephron are not sensitive to it. So this is going to lead to what? Inability of the nephron to reabsorb water back into the bloodstream. So inability of the what? Inability of the nephron to reabsorb water back into the bloodstream. And now when that occurs, there will be escape of huge loads of urine. So, and that will lead to what we call polyuria. Now, the urine is also going to be diluted. And since water is not coming back into the blood, there will be reduction in the blood volume. And reduction in the blood volume is going to trigger a mechanism called RAS. So, which means renin is going to be produced. And when renin is produced, renin will do a lot of things. But one of those things is that it's going to stimulate the thirst center of the brain. The thirst center of the brain. And when the thirst center is stimulated, this will lead to excessive thirst called polydipsia. Polydipsia. Now, after that, the person will be taking in huge loads of water. And now, for that, renin can also convert an enzyme that we call angiotensinogen. Just go and watch the RAS and you understand. So it is going to convert an enzyme called angiotensinogen into angiotensin 1. And angiotensin converting enzyme from the lungs, ACE, is going to convert angiotensin 1 into angiotensin 2. And this angiotensin 2 is a potent vasoconstrictor, like it constricts blood vessels. So angiotensin 2 is going to act on blood vessels and it's going to bring about their what? Constriction. They are going to be constricted. And now, when a blood vessel is constricted, it means the pressure of that blood within it is going to increase. So this is going to increase in the pressure of blood. And due to the constriction of this blood vessel, it will create a workload on the heart. The heart will have to pump more effectively against all this resistance. And that is going to give us a sign and symptom called tachycardia. So the word tachy means fast, and the word cardia is heart. So tachycardia means fast action of the heart. The heart will be beating faster, and that can lead to several complications such as heart attack, the cardiac arrest, and some other complications. So that is just the pathophysiology of diabetes insipidus. So let's quickly give a recap. So we said in diabetes insipidus, we said the ADH, antidiuretic hormone, is not produced, if that is if it is neurogenic. So like the brain is faulty, so ADH is not going to be produced. So, or it is nephrogenic, that is the receptors of the nephron is not sensitive to that hormone. So that will lead to what? Inability of the nephron to reabsorb water back into the bloodstream, and the water is going to be going out through the urine, and that is where we derive the name diabetes, to pass out insipidus, a tasteless urine. So which means the urine is diluted. So, and that will lead to a sign and symptom called the polyuria. So reduction in the amount of water in the blood is going to reduce the blood volume, and when the blood volume is reduced, it is going to bring about initiation of a mechanism called the RAS. So renin is going to trigger the stress center of the brain to stimulate it, and the person will be taking in more water, and that will lead to a sign and symptom called Polydipsia. So, and after that, we said what will happen next is that renin can also act on an enzyme produced by the liver called the angiotensinogen, and it is going to turn it into angiotensin 1. And when it turns it into angiotensin 1, angiotensin converting enzyme from the lungs is going to convert angiotensin 1 into angiotensin 2. And angiotensin 2 is a potent vasoconstrictor, and when there is vasoconstriction, it means the peripheral resistance has increased. So they have to increase its beating activity just to do what? To work against this resistance, and that will bring about what? Tachycardia. So tachycardia is also a what? It's also a sign for diabetes insipidus. So I take it that you really enjoyed this video. So if you do, just make sure you give it a thumbs up. If this is your first time watching a video from the Dssg Nation, then make sure to subscribe and you hit the bell button so we can notify you whenever I create any video. Hi guys.